on your knees for a elongated period of time, you can use a bolster in position, or you can sit on your butt. I always like, if I can be the bolster, it's better compression. They'll be able to tolerate more, and you feel everything because it's coming up against your leg. And sometimes if the client can tolerate a lot of pressure, I will literally put pressure from my leg underneath, pushing up into my elbow as I'm doing the work. It's kind of like pressure on both ends.
Hydraulic squeeze.
Yeah, like a little squeeze. So we have 4 main sections with this. Think of it very similar to when we did the knee though, because we have the top portion of the foot, we have both sides, and we have underneath. I'm going to go through what I'm going to do first on top and the sides, and then I'll go for the bottom. So we always will start on the tibia and fibula, and we're going to start about 2 inches above. I'm going to scale my way down. Our focus point, and this is for anybody if you're going to do like a spot treatment or some one-shot therapy and you're going to teach them. You have your medial malleolus on the inside, and you have your lateral malleolus, and then the middle is the talus. And there's tons of tendons and ligaments right here that come up through it, and you're gonna feel it. You can kind of feel it on your ankle bouncing over them. But we call this like, there's golden nuggets tucked into here, and that is going to limit that flexion and extension in the ankle itself. So if somebody has really bad mobility, my focus is, we call it the beginning of the horseshoe, because when we get them on their sides, coming around the ankle bone, around that medial lateral malleolus, is in the shape of a U, so it looks like a horseshoe. But I come into the talus first really thoroughly. That's a focus point. So 2 to 3 inches above on the tib and fib, work down into the talus. And then we have in our toes, think of it for toes for tarsals, and then carpals for carpal tunnel syndrome. So it's an easy way to kind of remember. So we have tarsals here, and then we have like metatarsals, and then your toes, which are like the little phalanges. So I'm going to start 2 inches above. And it's more pinpoint scaling, and the pressure can be close to a plowing, but I don't want that elongation of movements happening, because if you're moving too much at a time, and if my windshield wiper is even too big, at the tarsals close to the top, they're kind of close together. And then as they come down the pathway of the foot to the metatarsals, they start to separate. That's like where your toes kind of jolt out. So we want to work from 2 inches above into the talus. And this is where you're kind of just over top of the foot bones. Like you're going to feel a lot going on here. Try not to do too much face to side, because you're going to be coming over and it'll feel really like ripply and washboardy for them. So I try to stay on top of the tarsal and then allow my elbow to fall in between the gap, in between the metatarsals. And I use a little bit of windshield wiper here as I grind along all the way to the toes themselves. I stop here at the knuckles. Then I'm going to scale my way back up. And then I'm going to come down the next one. And so I'm kind of using like the pathways of these metatarsals as a guide to stay along. And this is a great area because when we're working the feet, you can go for reflexology, that's wonderful. We're hitting every reflexology point while we're doing it on surgical, so it's going to stimulate it all. But we're going to have more points on the bottom of the feet than the top. But this is a great area to help if somebody has a congested lymphatic system. This helps drain the lymphatic system. So if I was working on like an ankle surgery and certain things like that, I always, when I'm doing my effleurage massage at the beginning, I feel out around the ankle bones, because the body's weight over time puts so much compression here that it'll actually push some screws to the surface and they'll start to come out a little bit. And if stuff starts to get, like if the hardware starts to get rejected, I always tell the client to go into their doctor and get it removed, because the body clearly doesn't want it anyways. So it can't even stay in there and it's not stuck. So if they do have hardware in there and you're not feeling any of it, but it's just been that way for the past 10 years, there's going to be an excess buildup of calcium around the joint itself. So go in and clean it up exactly how we would do this treatment. You're just going to have to work a little harder. So monitor your elbow, because it will get sensitive. It's a lot of bone on bone. But if that hardware starts to get rejected, and you'll feel it, like I've seen a lot of screws protrude through the skin and it's just pokey. And they have to be, you can't work around that because you don't want to puncture the skin where the screw's coming out. So we can work all around it, but then I'd recommend them to go into the doctor and get it removed because the body doesn't want it. So first position, airplane landing, effleurage massage. Then I'm starting 2 to 3 inches above, working down into the talus, focus point. Then I'm going to scale along the tarsals and let my elbow fall off in between the metatarsals and carve that out all the way to the big toe, right up to the knuckle, and then back. and I'm gonna do each individual one. After I do that, it makes more sense when we go to the hands and we're actually doing the hot dog and hot dog bun technique, because it's like the hand is the bun, the finger is the hot dog. With the toes, you're kind of just using your index and middle finger to kind of hook underneath each individual toe. And some people get like bunions. You can focus on the bunion, but that's where it's really good to either have a shot glass or a guasha stone in your room, because I'm not going to do a whole ankle treatment with a guasha stone. That doesn't really seem too professional, but I'm not going to damage my elbow smashing this calcium buildup, that's little bone spur that they've created to make that bunion. So you can, if your elbow's pretty tough, but you're going to notice after about 3-4 minutes, oh, this is pretty tender. It's pretty sensitive now. So after I've cleaned
Can I
out,
ask a question?
of course.
So the, when you look at my x-ray, you can see.
You have a bone spur on the inside and the outside.
I have both. Mine's a
Yep.
bunion and it's calcified, but like a normal bunion is pretty much just a dislocation. So do you think the calcification happens first and makes it dislocated?
Nah, they had scar tissue in there, but I wouldn't say there was the calcification that made it dislocate immediately. They could have like jarred it. Their body, because it's a very stagnant area, they don't like have that proper mobility. As we age, it's like if you don't use it, you're gonna kind of lose it. And it's like, oh, I used to be able to shoulder check so well, and now I'm very limited here. So it's like if they're not doing the same things and exercises and lifestyle as they were when they were younger, and they think they can go to do that one thing, it can set it off a little bit. But the scar tissue was definitely irritating it. But then after it kind of got dislocated, the displaced calcium came in there, filled in that area, and now you have this ball. So after I clean out each individual metatarsal pathway, just kind of hooking an index and middle finger underneath, and this is fantastic for people who have like hammer toes. And they will start to go back even after one treatment, but if I really thoroughly work the toes, you'll straighten them out in one treatment.
You think?
Oh yeah.
God, I gotta go try it.
And so, but the thing is, can your client tolerate it? Can you tolerate me smashing your bunion right now? Probably not, because when I go to ask you, you're like, oh, I want it, but you're just not there yet. So it's like the person who wants the results in like the one treatment, the two treatments, they've been in pain so much every single day of their life. And yes, it's annoying, it's limiting you, but you're not noticing agony throughout the day. If you were in pain because of this, you'd let me go in for my 5-7 minutes as hard as I want, because what I live with is way worse than dealing with this
I
moment.
let your dad do that the first time he did it.
Yeah, but
It
it's,
wasn't 5-7 minutes. He was like, I'm gonna break the elbow.
yeah, you're gonna break it, but how many times have you done it? How many times have you pushed yourself to do that? How many times has a practitioner gone in and smashed it, like I said, because you've created
I don't have
bone
anybody
now.
where I am except for me.
You have Piper, that's not true at all.
Well, she doesn't do it.
Well, the thing is,
That's it.
So would you go in?
they're like the
Yeah, you
small,
want a shot
yeah,
glass, and I tell you, I do it myself.
but you can only put yourself through so much pain.
True.
Yeah.
So get Silsonic while you're here,
I have.
She did.
I'm gonna do it again today.
and that would help break that up.
Oh,
I did it
most
3 times
definitely.
in Mexico, it didn't help at all, not really.
So it's just about the consistency, and not letting it go, and like going past your comfort level a little bit. We all get a little too stuck in our ways where it's, this is my zone, it hurts, it's a bit, like, no, you gotta push yourself if you wanna see changes. And so, after I isolate though each individual toe, and I'm just hooking my fingers under them.
I've had a
Like
couple
so.
broken toes, just so you know.
After, okay, after I've done, and that's nice, but now I just know, like, are they broken right now?
No,
Then no, there's
They've
excess
been years.
calcium though, so it's good, but I know it probably will be more sensitive
How long does it
on
take?
those
'Cause
toes.
I did break one about 5 months ago.
You're great.
Okay.
5 months is plenty of time.
Doesn't feel like it.
So after I've done that though, from face to face, I'm gonna flip myself around, and on one leg, I'll be on the outside of her, and then on the other leg, I will be on the inside. And then I'm gonna do everything again, just scooping everything back up. And when I'm working, I'm just being mindful that I know things are connecting from here to here, so it's more vertical with 45-degree angles. Minimal shaving throughout each metatarsal. Once I have done that, can I steal a bolster? Just that purple one behind you, you're good. You can stay sitting. Hey, it's
Heavy as
not.
one.
All right, thank you. So now that I've done that, we're gonna go to the third position. Use that small towel. That's great. Thanks. I just wanted that for your knee. So in general, now that I'm gonna go to the medial side, you can see how I brought this, because if I go like this and there's no bolster supporting, it's just gonna flop around, and I don't want that. I want her to be comfortable. So taking that, tucking it in, and then extending myself a little bit. So I went to the medial side first because the lateral side, you gotta get them into fetal position. So they can just stay on their back comfortable right now to some degree. So I'm going to be starting, once I get to that medial side, I finished the top. I'm just flipping right now to talk to everybody right now. But in general, I would have finished face to feet, correct? Because I finished that top portion. So then I'm gonna stay face to feet, and I'm going to work the medial side of the ankle. So I'm starting 2 inches above, and I'm going to work down around the medial malleolus, and I'm scooping up into the ankle bone, on top of it, all around it. And there's no rules with that. People like try to just stay away from it, but like, no, come on top as well. But you're not gonna feel as much as you will like where it's inserting at. As I work my way around, I'm gonna come back and I'm gonna touch the side of that Achilles tendon fairly thoroughly, but I'm gonna get the Achilles tendon the best when they're on their stomach in prone position. So I work that Achilles tendon out down to the heel, the side of the calcaneus, and then we call them the spine of the foot because it's the bone that goes all the way out. So I'm just going to carve along the spine of the foot all the way out to the big toe. And once again, it's similar to when we were doing the lower leg. Put yourself on that conveyor. If I feel like I'm too far away and my elbow's trying to get to that big toe, I'm not just gonna stay sitting here. I just scooch up a little bit. So I make sure I'm always over top of the area I wanna be focusing on. I'm gonna do that from face to feet, flip over, and I'm gonna do it again from face to face. So now I'm pulling everything down. I pull everything up, and now it's down. So once again, starting 2 inches above. We're gonna work our way around the front to like the corner of that talus, around that medial malleolus, to the Achilles tendon, down to the heel, and out along the spine of the foot, to the big toe. When I get to the toe, people have a hard time working on it and keeping it like that, so just kind of pinch off and isolate a little bit more. So I've done that nice and thoroughly, face to feet, face to face. Now we are gonna flip her over onto her side, into fetal position. That can get tucked in between the legs, so it's nice and supported. And I'm just going to stay face to face because I'm already here. So I'm gonna be pulling everything down from 2 inches above on the corner of the fibula, working down around the lateral malleolus, coming back into the Achilles tendon, back down to the calcaneus, and along the spine of the foot on the lateral side. We're gonna do that from face to face, flip on over, do it once more. I don't even like the bolster here on this point because and that's where I was seeing you earlier, and I was like, oh, you're too raised up when he's flush. So we're gonna just scooch that out. I'm gonna tuck myself in, and I might actually just bring this one just for your knee. But I wanna be mostly the bolster whenever I can. So once again, starting 2 inches above, down around the lateral side, Achilles tendon, heel, out along the spine of the foot. Once I was thorough there, then we'll get her onto her stomach and we'll focus on the Achilles tendon, the calcaneus, and plowing through the arch of the foot, focusing on if anybody has like dropped or raised arches, and then the bottoms of the toes. But I'm gonna demo that for everybody, if we're comfortable with that, before I flip her onto her stomach. Yes, please.
What's the calcaneus?
Calcaneus is your heel.
Okay, yeah, okay.
Is that good though, so far?